Hello, everyone. Welcome to today's PermanenteDocs Chat. I'm your host, Alex McDonald. As always, I practice family and sports medicine here in Fontana, California, as part of the Southern California Permanente Medical Group. So today we have a probably record-breaking number of registrants for a phenomenal talk. We are talking about AI and really pushing the boundaries of medicine with technology and AI with Dr. Graham Walker, who is an emergency medicine physician at the Permanente Medical Group in San Francisco. So welcome, Dr. Walker.
Thanks so much for having me, Alex. It's good to be here.
I'm really looking forward to this conversation, as our based on the number of registrants we have, many of our audience. So if you're joining us live, please drop your questions into the Q&A box. Get them in early. These chats are short and high yield. And shout out to those of you joining on LinkedIn Live as well. So we're gonna jump right in as we always do. So my first question, Dr. Walker, tell us who you are and what you do.
I don't know who I am anymore, Alex.
It's hard to keep track.
I'll do my best. So I'm an emergency physician at KP San Francisco. I live in San Francisco proper. Been practicing here for 12 years now. My kind of the other hats that I wear with TPMG are I used to be the assistant physician in chief for technology, so that's kind of like tech operations for my medical center. I still serve on our KP Health Connect, our EHR steering committee for Northern California, for representing all 1,000 ER doctors, and also for urgent care. And more recently, I've been working on AI and innovation, kind of advanced development, as we're calling it, for Northern California as well, trying to bring in more AI in healthcare. My other roles, I have a cat here who won't leave me alone. The other thing I'm proud of is I created MD Calc and the NNT, two free evidence-based medicine websites for because I like to program and build stuff and create problems. So
very nice, awesome. So you clearly a health informatics leader and in creating of a med calculator app. So that's pretty cool. So you're obviously a tech innovator yourself, but also a physician, and I think that kind of cross section of those two important things is really valuable. So, from your perspective, things are moving so rapidly within the world of tech and AI. What are some examples of its impact on care delivery at this point? Or is it like we just need to sort of slow down and take a breath because it is happening so quickly?
Yeah, great question. I think we would all like to speed up, but just because there's so much demand and there's so much opportunity around AI, I think we all, if you practice medicine, you see day to day all the problems and all the things that could be made better. And if you know anything about AI, you see the potential there. But I think we all also recognize it needs to be done safely. So I say we're going twice as fast than I thought we would, but like 10x slower than I would like to. But that's the kind of the normal push and pull of healthcare is we need to do this safely and roll it out, and make sure that the tools that we roll out are safe and effective for patients, doctors, staff, whoever it is, that we do them correctly and appropriately.
Yeah, no, I think that's the key. Obviously, is sometimes we want to move quickly, but taking a breath and moving more methodically can certainly have more dividends and less problems in the long run. So again, I am not I can use computers and I can use technology, but I don't really understand them in a lot more deeper meaning. And I think one aspect which feels overwhelming is we're just hearing all these things about AI, this, AI, that. Is there any way that you can kind of break AI into sort of smaller categories or buckets to help us sort of conceptualize how augmented intelligence will really impact different aspects of medicine as well as physician work? And most importantly, the thing that I care most about is how is it going to impact the patient-physician interaction?
Sure. Yeah, sure. So it's a great question, Alex. Even when I say the word AI, I kind of am naturally thinking about things like ChatGPT or Bing Chat or Claude or any of these other tools. But AI is almost becoming a little bit of a garbage term, a catch-all term, because it's become marketing, it's all over the place. So the way to think about it is, I think the three big areas that we'll see are in kind of the generative AI space, and that's going to be like creating content or from a prompt, right? That could be creating an image, it could be creating text, it could be generating fake patient data, right, from a prompt. The other thing that the two other areas, one is kind of a part of deep learning or neural networks is for radiology, right? So for reading images, that's another type of AI tools that will be used called convolutional neural networks. And that's really it's called a neural network because it's literally computers hooked together to actually try to work like neurons in the human brain, where like they talk to each other and some of them cancel each other out and all that stuff. And then the third one is going to be really machine learning, and that's going to be predictive scores and algorithms, kind of like what's on MD Calc right now, where you take a bunch of patients, you train a model on you take a bunch of people that have appendicitis, and then you try to take all their data and then predict which ones have appendicitis in the future. So that's machine learning. And those are probably the three biggest areas. AI is actually like a huge thing with dozens of different like sub-specialty areas, but those are probably the biggest three chunks that we'll see in medicine, I think, in the future.
Okay, that is definitely helpful to sort of break it into those buckets, because you're right, it is sort of this sort of catch-all marketing tool when you talk about AI. There's a question which always comes up, which I think we should sort of address here, is will AI replace humans? Will they replace us in the way we practice medicine, be it physicians or nurses or physical therapists or pharmacists, you name it? Like how difficult will that to do, and how is our organization sort of approaching the issue to ensure that technology complements and serves physicians, as opposed to creates one more clicky box or one more thing to do throughout our day?
Yeah, so there's a quote I really like. It's from Sam Altman, who's the CEO of OpenAI. And he said that, and I really truly think this is the right way to frame it. He said that these tools are really good at tasks, but they're not good at jobs. Now, and who knows in the future what that means, but I think, honestly, for the next 5-10 years, whatever it is in healthcare, AI will help us with tasks, but it will not help us with our job of being a physician, a nurse, a pharmacist, right? There will be certain parts of our jobs, like tasks we need to complete, that it will absolutely help us with, whether it is work notes or paperwork or billing or pending orders, like tasks that you have to do to get through your day. But I don't see it replacing humans as a job. I think in TPMG we have a huge structure of technology, like they're called department tech leads, and so they're technology supporter physicians who are mostly practicing physicians, but understand technology and can give feedback about how this works, how they would expect or want it to work. And so I think we have a pretty good structure that really will help us build tools that are saving people time and making doctors and patients happier, more effective in their roles, but not making more work for people. Obviously, that's like the antithesis of what AI should be doing for people.
Yeah. Well, and I'm looking forward to when the tasks that AI can do are like the laundry and the dishes at my house. No, I'm just teasing. No, but I think that's a really great point. Is there are so many things that we do throughout our day as physicians, and some of those really do require sort of cognitive thought and skill, and a lot of sort of more intuitive practice of medicine versus sort of like algorithmic. But then you can take all those other tasks off our plate, and it can really free us up to really practice at the top of our license, quite frankly, and do the things that only a human brain can do. A great example, we started using a kind of basically a machine listening tool in our clinical exams, and you put the phone down, it listens to the conversation you have with a patient, and then basically creates much of the note. And it really has brought so much more. It's really brought me back to the joy of medicine, right? I get to sit down and talk to a patient. I'm not stuck there with my nose in the computer the entire time, not even looking at the patient. And I feel like that human connection is so invaluable. And I'm hoping that's where, and this is, again, we're kind of probably dipping our toe into the possibilities of AI at this point. And I'm looking forward to how that will continue to improve physicians to really practice at the top of their license and enjoy the practice of medicine and get rid of all those tasks which really just burn us out, quite frankly. What are your thoughts?
Yeah, I mean, I think for many years, a lot of physician work has felt like it is data entry or clicking boxes, like you said. I think AI can, I really do believe that AI can get us back to the bedside, that we can literally just focus on the human being in front of us, not the virtual patient existing in the EHR. I'll tell you the one area where I don't like the AI scribes, and again, this may just be the change management of my brain, but it's back to that. It goes back to the doctoring work. I don't like it when it starts to tell me my assessment and plan, because that I find when I'm writing my note in the ER, that is the time when I actually have to do, that's when the medicine is being practiced, where it's like my brain is taking the stuff from what the patient said, the exam, the vital signs, and I am running it through my little CPU to come up with a differential, to come up with a plan, to come up with, okay, the second rate step of like, okay, if this fails, what's the next step in the workup, whatever, right? So that's the piece where like, I don't really view that as a task. I view that as the job. And that's the piece where I actually prefer to be doing it all myself.
Yeah. No, I completely agree with you. And I think that's where the computers they'll never be able to replace us, but they can better synthesize huge volumes of information. I think part of it too is, medicine is complicated. Medicine is a team sport. And I'm hoping that augmented intelligence can be kind of one aspect of the team of medicine, so to speak, to help us, synthesize data into a way that's meaningful and useful, rather than sort of just tell us what to do, quite frankly.
Yeah. No, I mean, I think from a growth mindset, I think every physician would love, like, sometimes you have to curbside somebody. Sometimes you're like, am I crazy? But is this the thing that did I miss this day in med school where this plus this is a disease process, right? So I think any physician who is confident in themselves would love to have a curbside consultant that they could just ask a question to, or that's kind of like looking over their shoulder, helping them to not make a mistake, whether it's like just a stupid drug dosing typo that they should have fixed, and luckily a pharmacist helps with that. Or it's you're about to discharge somebody that might be about to have a bad outcome. I would love that help, and I think most people would too.
Yeah, I completely agree with you. So let's switch gears real quickly to sort of some of those predictive analytic tools that you talked about. Where are we at this point with those predictive analytic tools, and what steps should physicians take to really kind of evaluate and make sure that they are helpful and accurate, rather than sort of more kind of traditional diagnostic methods?
Yeah, that I think is these machine learning tools, I think will actually be the more impactful tools in medicine in the long run. I think we have mostly focused on generative stuff because OpenAI has made it so easy to kind of plug and play and very rapidly deploy generative kind of text-based tools in every field, right? I mean, it's literally like 5 or 10 lines of code, and you can have OpenAI doing generative stuff for your work. Versus the ML tools, like a predictive score for appendicitis or something like that, that's going to require the same amount and maybe even more evaluation and validation, just like we expect those validations with peer review and validations in the medical literature today. I think the other piece that we're all going to need is some extra education and training on how do you critically evaluate these tools and figure out like, oh, hey, you maybe shouldn't use this tool. You should use that one because this one wasn't trained in your patient population that's sitting in front of you. Maybe it's like, 85-year-old diabetics with a hip replacement, right? It could be that level of specificity, but we'll need the ability to, just like you and I, Alex, could probably have a debate about sensitivity and specificity. I think we'll need that type of lingo and thinking in that way when these models start to get into clinical practice as well.
Yeah. And I think the other thing too, we have to be very cognitive of as we kind of begin to roll out some of these models is to make sure they're not programmed with sort of some implicit bias, right? Because we are all human beings, we are all imperfect. And I think it's really, really important. You have these massive data sets, it can help sort of limit that. But at the same time, if we're not sort of strategic and thoughtful and inclusive about how we program these predictive analytics, we could potentially be sort of biasing ourselves before we even begin, quite frankly.
Yeah, I mean, that is literally why I spend so much time talking about stuff on LinkedIn and posting stuff. I try to get people excited about this kind of AI revolution or whatever it is, because I think we're going to need so much help in doing this accurately and safely. I think we need people thinking about and discussing all of these issues. I think we need data sets that, like you said, are as inclusive as possible. I think that's honestly one of the biggest benefits of KP is we have probably the highest quality, most diverse, most longitudinal data set in the world. Personally, I think that's one of the reasons that we're going to be particularly successful with AI. But you're absolutely right. I think the other challenge is it probably will get harder at some point for the physician to know if the AI tool is right or not. So, like if you got a appendicitis score and you get a point if the white count's over 12, and the white count's 11.9, you can make a determination and be like, that's close enough. Let's go ahead. Let's go down this route. With some of these AI models, they are more black boxes, and we may not really know why it's saying, yeah, this patient probably has appendicitis, which will just kind of be a new challenge that we all need to figure out together.
Yeah, I completely agree. And I've said this before, so I apologize to those of you out there who may have heard this, is, whether we like it or not, AI is here. And I think physicians need to be on the ground floor so we can make sure we build these tools that are useful for patients and physicians. And if we sort of say, no, we can't do this, dragging our feet, kicking and screaming, somebody else will build it for us. And it's not going to be very user-friendly. Let's just leave it at that. I won't give any examples of historic importance, but we'll just leave it at that.
I completely agree with you, Alex. And I meet with technology companies every week who are building solutions. Some of them are better than others, but it is very clear when they don't have a clinician on their team giving recommendations about how a tool needs to or cannot work.
Wonderful. Yeah, thank you for doing that work. Well, there are a billion questions in the chat so far, so I'm going to try to kind of pick out some of the best ones here. We've already touched on some of them. So one really good question here is looking at the future and sort of emerging technologies, what do you see? What are you most excited about, and how will that transform patient care?
I guess I'm most excited about two things. One is there are a lot of areas of medicine where we don't have great tools, right? Like, I don't love TIA stuff. I don't love syncope stuff. Like, I think there are areas where we have okay tools, but that we could do so much better. And I think there are a lot of opportunities to actually make things better for everybody, right? Better for the patient, better for the healthcare system, better for the doctor. And I think AI will really, really be able to do that. The other area that I really like is in the generative space. The ability to answer every single question a patient has.
Yep.
I don't have time to do that. I would love to. I wish my favorite days in the ER are when it's like SLOW, but I can actually take the time to explain everything really clear to a patient, make that connection, make them feel reassured. And I often don't have time to answer every single question that I want to for them. But an AI tool that's appropriately trained and appropriately grounded in medical information and their own context of their own body and their medical history, I think could do wonders for patient engagement and just to make them feel more supported.
Yep. No, and as a primary care doctor, I get, tons of emails every day from patients who have questions. And I try to respond to those as much as I can. But if I can have a tool which knows the patient, knows kind of me and my practice, and then I can respond to those patients appropriately utilizing technology, that will be, again, a win for everybody. The other thing which I'm really excited about is, predicting, if we have a patient who makes an appointment right now, all of our appointments are the same length, right? And if I have a patient who's really, really complicated, it just came out of the hospital, I may need a longer appointment with them versus, a urinary tract infection or just a cold. Like, I can probably do that visit in 5 minutes, and we can have sort of adjust the appointment times based on the amount of time and energy it's going to require to see that patient and really care for that patient appropriately. So we can, again, utilize our time more appropriately as well. That's, as a primary care physician, that's something that I'm really looking forward to.
I absolutely love that. And that's kind of what we talk about a lot as like probably the next step. I think first we'll probably work on automation, and then really the bigger gains may come with personalization, where it's like we are able to not just personalize their score, but personalize stuff for the doctor, right? Oh, just like you said, this patient has 30 medical problems and active cancer. They're going to need a longer time period than something straightforward. Or maybe AI could, or an e-visit or a telephone visit could effectively handle the straightforward stuff so that the human doctor can help with the particularly challenging, complex stuff.
Right, exactly. Another great question here in the chat. For physicians with technology backgrounds, or particularly an interest in this area, or getting more involved to help kind of shape our organization's AI approach and implementation, how do you suggest people get more involved, or where can people learn more?
Oh, that's such a great question. I've been thinking about that a lot. So, there's a lot of I have learned probably the majority of the way that I keep up with this stuff is honestly YouTube. I will be completely honest. There are a number of really great AI education and training tools, and almost like AI YouTube influencers who are just constantly making new videos about the latest in AI. I think the other really powerful tool, there are a lot of honestly really good free tutorials. I do think it requires a little bit of understanding of how the technology works. So if you could, and I'm happy to give listeners some examples, or maybe I'll post them on LinkedIn or something. But there are a lot of really good tutorials that teach you how AI works, so that you can understand, like, oh, actually, it could solve this problem, but no, it's not going to really do a good job with that one. Honestly, a lot of what I've learned is through YouTube, social media, and then just playing around with ChatGPT. ChatGPT and Claude both have a thing called a playground, where for free, without an account, you can just mess around with it and see what responses you get. You can mess around with a thing called the temperature, which is like the creativity of the response, and you just have to try it out a bit. And then once you understand where it works and where it fails, I think then you can kind of plug in that knowledge, combine that with your medical brain, and then see, like, oh, this could solve this problem, or oh, it's not solving this one very well. So that's what I would recommend, is reading a couple online tutorials. I don't think you really need to get into the programming piece if you don't want to, but the programming is actually quite simple. And if you can't get the programming right, like ChatGPT can just help you fix your code anyway. That's how I would get started, and then just start talking about it. I think we need as many people talking, whether it's on social media or in journals or just with your colleagues. I think we need as many people in as many specialties talking about this, so that, like you said, so that we have physicians representing our specialties and setting expectations and kind of, what requirements we'll have for a tool to be acceptable to us.
Yeah, I completely agree. So there's a comment here in the chat, which I think is great, which we kind of touched on a little bit. AI will not replace the physician, but the physician using AI will replace the physician who is not.
Yes.
And I think that is a point, right on point. And so wanted to share that.
Yeah, it's probably true with every single profession, right? I mean,
sure.
I was talking with an AI guy recently who said, the world will be unrecognizable in like 5 to 10 years, in a similar way that, like, we couldn't remember not having a phone, or using MapQuest instead of Google Maps, like having to print out MapQuest. I mean, even MapQuest was mind-blowing, right? But it will be a world where it's like hard to actually fathom. Like, Alex, we'll talk in 10 years and be like, how did we manage whatever TIAs, whatever it is? How did we manage that before we had this tool that made things so much better?
Yep. No, I completely agree. I don't even talk about like folding the old school map, right? And the art of folding a map is probably long gone. But anyway, I digress. Another question here, which I think is a great one. So let's talk about the ethical implications of AI in the clinical space when it comes to, patient preferences and privacy. What are some of these ethical implications we need to think about, and sort of what policies and guardrails do you think need to be in place to really protect patients?
Yeah. So, one of the challenges with a lot of these, maybe one of the biggest challenges, or the challenge, is these models can't create new information. Now, they can combine information they've seen in new ways, but they cannot think like they don't have an imagination, right? So whereas you or I could come up with a novel story or come up with like a really complex case that would be really medically challenging to manage, these AI tools almost, they almost can't come up with a new novel scenario. And so if you have a patient with Prader-Willi syndrome, and the AI tool says, oh, well, if they're constipated, just send them home. And it doesn't know Prader-Willi syndrome patients have, challenging, GI motility reasons for lots of reasons. It may give you a wrong answer. And so it's only going to be as good as the data it's trained on. So any biases that already exist in medicine, and there are already many, and they are not just in research papers, but they probably live to some degree even in our medical notes. Those will be represented in the AI tools as well. Now, we can try to train those away. We can try to correct the thing and say, no, 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 bad bot, ignore this thing that's a bias. But natively, those tools will find correlations that are probably honestly biases and not actual correlations. They're actually a bias in the system.
Yeah, no, I think that makes perfect sense. All right, this is phenomenal. We could go on and on for days. We'll have to have you back for part 2 and 3 of this conversation. Last question, and this is always the one I end with. What makes you most proud to be a Permanente physician?
Oh gosh, I would, a lot of people said that I'd be in academic medicine and like, oh, you love to teach and you're so good at teaching. And I do. I'm not trying to brag. I do like teaching and I think I'm pretty good at it. But, I was a social policy major in college, and I really just find the incentives are way more aligned to help our patients and help me make the right decisions and help everybody make the right decisions within TPNG and KP. And Alex, I also think that's the reason that we will be the most successful organization when it comes to AI. AI is all about trying to make things efficient and reduce waste and get things done quickly. And that's literally what KP tries to do. If we all benefit, most importantly, our patients, if we can manage a strep throat in 1 visit instead of 2, or manage an elbow fracture in 3 visits instead of 7, whatever it is, right? And so I actually think that's why we will be extremely successful with AI once we get a good clip going, is because AI is actually perfectly aligned with KP as well, which I'm super excited by.
Yeah, sounds a lot like the quadruple aim.
It's not blowing smoke. I really do think that AI can honestly help us with a ton of that, and be better for literally everybody.
Awesome.
I'm optimistic.
I am as well too. And so, well, thank you so much for joining us today, sharing your insights. This has been enlightening, and we'll definitely have to have you back. I feel like we could go on and on and on about this topic.
Totally. Thanks so much for having me, Alex.